madness.
Here we have our patient that we're going to be treating today. Alright, step number 1 in putting on the SpicaCast is to find some Pantaloon, which is a liner that's going to go on the inside of the SpicaCast. These are size 2, 4, 6, and 8. On the back of the box there's weight-based estimates for the sizes, and use the appropriate size.
You're going to put a belly bump inside patient, between the pantaloon and patient. Pillowcase, towel, whatever is available. It is easier if you make it a little bit narrower for the perineal area. Put it inside. Tuck it in like that, so that your pantaloon doesn't shift around so much. Tape it to the patient's shoulder. You can tape it to whatever leads are in the way too. It's fine.
Note when setting up the Pantaloon that the post of the SpicaCast table should be underneath the Pantaloon. So between the patient and the Pantaloon is the SpicaCast post.
Patient needs to be in a seated position, hips flexed so they can sit in their car seat, knees flexed so that they can be comfortable and safely positioned in their car seat. So, and their hips are going to be, knees going to be shoulder width apart. This patient has femur fracture, so this cast will be put on 1.5 leg. Always start with the torso. Easiest to start with a large web roll, rolling around the torso, making sure to capture all of your cortex. It is not necessary to put too much down on the lower part. Actually, you want to put more towards the upper, right around the nipple line. Chick advanced maneuver, so that when you fold back your cortex, it is much more comfortable. There's extra padding when the patient leans back. Now, going down said affected leg. Figure of 8. Split the web roll. Split. Tuck. Pull up as if you were pulling up the padding. Split. Fold in, and then roll down the leg, whatever's left over. Quick advanced maneuver number 2. Go deep into the groin. Pull up said padding. Do not commit resident sin and forget to pad the butt. Rip and tear, rip and tear. Making sure to get the gluteal cleft pad, whatever you want to call it. Tuck it in. Going down opposing leg. Halfway, keeping in mind you need to stay at least a finger's breadth above the popliteal fossa. Figure 8 move helps to hold your fracture. Making sure to get nice and inside. Deep inside the pocket. Roll high. Low in the anterior, high in the posterior. So that the popliteal fossa is open.
Here she's finishing off the leg, just rolling down the injured leg and finishing off the soft roll. can cut off the extra pantaloon once you get your soft roll wrapped and you're comfortable with the position of your soft roll. Now is a good time if you're using C-arm to make sure that your reduction is adequate. Take 2 views using the C-arm and make sure you're happy with the position and that you can hold it reduced.
Rolling. You don't need to put too much down here because as you're building the legs, you'll build your thicknesses here. So you truly can build more of it up here. Watching your margins. Did you catch that? Watching your margins. Advanced maneuver. Fan fold. Place extra. Chips wide. Capture. Figure 8. Come in through the leg.
I'm just going to continue rolling the fiberglass down this injured extremity. Very important for the holder to hold in the appropriately reduced position during this phase.
So, hip flexed, knee flexed. Fan fold, roll, figure 8. Tuck. Keeping in mind, hips need to be shoulder width apart. Don't commit intern sin and forget to get the butt included. Keeping in mind your margins. Popliteal fossa. Cutting for diaper area. This is when you can remove said towel or a pillowcase or whatever. You can now make your tuck backs. If this post were removable, you could take your post out now. This post on this table is not.
Fast and smart.
This is only so that you can see what the posterior side should look like. Pedal the posterior side like we did in the anterior.
At this point, it's just a matter of putting on the final wrap, which Chick is doing a okay job of. When it's all done, here's the final product. You have the perineal area open and padded, the chest padded with room to breathe, room for the belly. You can do plus or minus a bar across, but this is looking good.